Hi friends, welcome back to my channel Nursing Guru. In today's video, we will discuss something about APGAR score, one of the first assessments we will perform on newborns. By the end of this video, you will understand what APGAR stands for, then how to perform the assessment, and how to interpret the results of APGAR scoring. Let us start with APGAR scoring. The APGAR score was first developed by Dr. Virginia APGAR in 1952 and is now used worldwide. It's a quick way to assess a newborn's health immediately after birth. APGAR is actually a short form where each letter stands for something you need to check. Where A stands for appearance, where we will check skin color of newborn baby. Then P stands for pulse rate, that is heart rate. Then G stands for Grimace, where we will check reflex irritability. Then another A stands for activity, where we will check muscle tone. Then lastly R stands for respiration, that is breathing effort of that newborn baby. Usually the APGAR scoring is done at first minute after birth and again at 5th minute after birth. For each of the 5 categories, we will assign a score of 0, 1 or 2. 0 means absence of something. Later I will tell. 1 means presence but not good. 2 means present and good. This gives a total score ranging from 0 to 10. Let us see in detail. First, we will start with appearance, that is skin color of newborn baby. Pink is the normal newborn skin color. In appearance, we check baby's skin color. If the baby appears blue or pale all over the body, then score is 0. If the baby appears blue or pale all over the body, then the score is 0. Body is pink but extremities are blue. Body is pink but extremities are blue, including hands and feet. Then the score will be 1. The baby is completely pink from head to toe. Then the score will be 2. Then if we see pulse or heart rate, if there is no heartbeat, then the score is 0. If the heart rate is less than 100 beats per minute, then the score is 1. And if the heart rate is more than or greater than 100 beats per minute, then the score is 2. Then in Grimace, we will check reflex irritability or facial expressions. In Grimace, if there is no response to any stimuli, if there is no any response to stimulation, then we will give the score 0. If there is a weak cry when stimulated, if there is weak cry when we stimulated with something or when we pinched, then score will be 1. Then for stimulation, if the baby pulls away or if it sneezes or if it coughs or if it cries vigorously, then the score will be 2. Then in activity, we will assess the baby's muscle tone. If there is limp or if there is no movement, then the score will be 0. If some flexion of extremities, there will be the score will be 1. And if there is active motion, flexed arms and legs, then the score will be 2. Then in respiration, we will check the respiratory rate. For respiration, we are evaluating the baby's breathing. If there is no breathing, then the score will be 0. If there is slow or irregular breathing, then the score will be 1. If there is a good strong cry or regular breathing pattern, then the score will be 2. Let us see an example. A newborn is delivered and the newborn assessed at first minute after birth. The baby's appearance, that is skin color, is pink, but that baby's hands and feet are slightly blue. Appearance of that baby is pink, but hands and feet are slightly blue. For this, we should give score number 1. Then pulse. The baby's heart rate is 120 beats per minute. That is normal one. Hence, the score should be 2. Then grimace, that is activity. When we flick the bottom of the baby's foot, baby cries. Hence, that is normal. Hence, the score is 2. Then activity. The baby's arms and legs are flexed. The score is 2. Again, this is normal. Then respiration. The baby is crying vigorously with regular breathing. This is also normal. Hence, the score is 2. Then how to interpret this? Add all these scores. That becomes 1 plus 2 plus 2 plus 2 plus 2. That becomes 9. Hence, at first minute, APGAR score is 9 out of 10, which is excellent, and we will check APGAR scoring again at 5th minute. Hope you understood. Then we will say another example. Let us consider a newborn assessed at first minute after birth. The skin color of that newborn baby is pink one and blue hands and feet. Pulse rate is 110 beats per minute. The baby sneezes, coughs when stimulated. Then there are active motion. Then there is strong cry. Comment me your answer in comment box. This is all about APGAR scoring. Remember, practice makes perfect. When you are in clinical rotation in NICU, try to observe or try to do APGAR assessments if possible. If you found this video is helpful, please like and subscribe for more nursing education videos. If you have any doubts, ask your doubts in comment box below. Thank you.